my perspective, college success goes hand in hand with mental health.
College can be a wonderful time, but also very demanding. And for a lot of students, it marks the transition into becoming an adult, choosing a career path, and that can be a lot of pressure.
We might have so much stress going on that we don't really realize that we're not taking care of our mental health.
It comes down to students' ability to concentrate on something for an extended period of time.
The Trellis Foundation and Gallup recently did a study showing that the #1 reason that students are wanting to leave their post-secondary education is personal stress or emotional stress and personal mental health.
So yes, I definitely think there's a stigma around mental health with college students. There's a lot of just downplaying the mental health and not understanding how much it could actually affect a student.
I do perceive a stigma here on campus, especially with my mentees that I mentor here. A lot of them are male, and I see that there's a stigma. I see that they get a little bit uncomfortable, and I see that it's a topic that's not really brought up in their day-to-day. So there's definitely some pushback there.
One of the things that we see the most often in this space is the stigma around mental health, and seeing that a lot of the approach is thinking of personal mental health as an individual problem versus a reflection of the context in which we live, work, and learn.
It's super important to have that peer-to-peer connection. So I do host a radio show on our iRadio station here. I also intern for the iRadio station. So on there, I kind of just use my own insight and my own journey, and I talk about tips. I talk about the importance of meditation.
So through my program at the University of St. Thomas, I am interning here at University of Houston downtown. So I see clients in their counseling services department as a practicum student.
When students advocate for other students' mental health, it really helps because it creates that connection, reduces the stigma.
In my perspective, it is very important for students to play a role in advocating for mental health on campus, because at the end of the day, yeah, if you do go to a counselor, they can help you, but sometimes you just want to have a person that you know knows you.
I am the vice president of Psychology Club, and Psychology Club is, for me, a safe zone because we're learning from each other. We are overcoming problems that we don't really speak about with friends and family.
I think it's important that we know how to support one another. We do a lot of outreach with students. We are a resource for them as well, and we just are very interested in changing the conversation about mental health and providing support for others who need it.
And it is really imperative that institutions of higher education recognize their role in student mental health and faculty and staff mental health, because they can play a substantial role in creating a universal environment, therapeutic supports, and crisis supports that really support that mental health and well-being, and also student persistence.
If I was the president of the college, I would do a lot.
I think I would emphasize more involvement from faculty, and perhaps creating a student wellness department.
I would most likely, for mental health, have more information publicized about what we offer as a college.
I think I would focus mostly on training people, getting people more informed and educated on mental health.
When I think back to the mental state that I was in when I was an undergrad and who I saw when I looked to my support system around me, it wasn't much. And it wasn't the greatest experience. So I think the most meaningful and rewarding part of this job and working with this population specifically is being able to kind of pay that back and be able to be, if even the littlest amount, a part of the change and making a difference in the students' lives, because it absolutely would have made a difference in mine.
To be able to stand in front of a camera and say, what I went through was really hard, but because it was so hard, I want you to realize that what you're going through is hard and we can make it easy together.
Whenever we do outreach events and we talk to other students, I see the reaction, and they always tell us, this is great, I didn't know that this existed. And it has been a truly rewarding experience.
Or even if they didn't go through it themselves, maybe they did, and they say, oh, this is something that I went through too. It's more open, it's more like an equal dialogue. And so when I feel like I'm being heard by my peers, that's usually when I can sense that.
in helping one student, you create this snowball effect, and students tend to pay it forward. And I love to see that. I love to see that the support grows.